The Ogden Surgical Society formed after a chance encounter between three doctors in the coat room of the D Memorial Hospital. Early one morning in February 1946, Doctors Ezekiel Dumke, Clark Rich, and George Pfister were getting ready for a busy day at the D Memorial Hospital. While in the cloakroom changing into their white coats, they discussed forming a group that could hold annual education meetings. "Are you fellows really serious about this thing?" asked Dr. Pfister. "If you are, let's each call a physician who could give us a good message, find out when they can come, and get this thing going." During that chance encounter, the doctors made it official and set the dates for April 18th, 19th, and 20th, 1946. Each doctor would invite one speaker to attend. Dr. Pfister invited Dr. Charles Huggins, Dr. Rich invited Dr. Charles Mayo, and Dr. Dumke invited Dr. Alton Ochsner. Because Dr. Huggins was the only doctor who was able to attend, he was set as the keynote speaker for the inaugural conference. While Dr. Ochsner was not able to attend that year, he became a regular speaker for many meetings to come and was considered a dear friend of the society. The meeting, then called the Spring Surgical Clinics, would be held in the nurses' lecture room at the D Memorial Hospital with only 7 speakers. So many doctors attended the first meeting that they were standing in the doorways to hear the speakers. The following year, the meeting moved from downtown Ogden to the Ben Lomond Hotel. By 1948, it had to move to a larger venue at the Orpheum Theater. Membership between 1946 and 1970 grew from 38 to 140. The conference averaged about 170 registrants each year from all over the Intermountain area. The meeting became so popular among northern Utah doctors that they would close up their offices and clinics and cancel all elective surgeries on the days of the conference just to attend. Dr. Ezekiel Ricker Dumke, known affectionately as Zeke and the doctor with $1 million smile, was born on December 15, 1886 in Wisconsin. He graduated from Northwestern University Medical School in 1910. He came to Ogden and worked under Dr. Ezra Rich and alongside Dr. Clark Rich. He was appointed the surgeon for the railroads and Utah Power and Light Company. While in Ogden, Zeke met a young woman named Edna and declared that he would wait until she was older to marry her. They married June 25, 1917, and raised 3 children together: Martha, Ezekiel Jr., and Edmund. When the First World War broke out, Zeke enlisted in the Medical Reserve Corps and was stationed at bases throughout the United States. At the end of the war, he was sent to New York and worked in one of the debarkation hospitals. He returned to Ogden in 1919 and opened his own private practice. Zeke served as chief of staff at D Memorial Hospital and was the first chief of staff at the newly built St. Benedict's Hospital, which he helped bring to Ogden after seeing a need for more than one hospital in the area. Dr. George Morgan Pfister was born in Logan, Utah in 1892 as the only son to John and Jenny Pfister. He married Ruby Osler in 1914 and graduated from Rush Medical School in Chicago 4 years later. During World War I, he served in the U.S. Naval Medical Reserve. He served in the Utah National Guard and practiced general medicine from 1919 to 1923 until he took a urology residency. Upon completion of his residency in 1928, he set up his practice in Ogden, where he and his wife raised 2 children. One of George's greatest achievements was being elected president of the American Medical Association in 1962. He also enjoyed teaching about medicine and served on many medical boards throughout Utah and other parts of the world. Dr. Clark Lowe Rich was born in Ogden in 1901 to local Dr. Ezra Rich and his wife, Annie Lowe Rich. Clark was indecisive about whether or not to pursue medicine like many of his family members had before him. It was not until after his LDS mission that he decided to enter pre-medical training at the University of Utah. He went on to graduate from Harvard Medical School in 1924. In 1928, after his internship, Clark returned to Ogden and worked alongside his father and Dr. Dumke. He was also the surgeon for the Denver and Rio Grande Railroad. Clark married family friend Dorothy Snowcroft in 1929 and had 2 daughters. He continued to practice general medicine and served on the surgical staff at both D and St. Benedict hospitals. He focused on orthopedics and abdominal surgery. In 1944, he became chief of staff at the D hospital and later chief of the surgical staff at both hospitals. He was a dedicated doctor and often worked for free so patients could get the help they needed without worrying about how to pay for it. Many times he worked out of his home to give vaccines to neighborhood children, free of charge. The founders of the Ogden Surgical-Medical Society were like-minded and dedicated physicians, community members, and family men. That unique dedication has transcended to all members over the years. As Dr. Pfister said about the first years of the society, the Ogden Surgical Society is a most unique organization. The success of this annual meeting has been possible not only because of the work and efforts of the doctors of medicine, but in addition, by the loyalty and support of the community of Greater Ogden, the state of Utah, and the Intermountain area. There are several stories that showcase the importance of both the society and the founding doctors to the larger Ogden community. This story was shared in 1955 by Sir Rodney Mengut, a prolific writer of medical books for postgraduate surgeons and editor-in-chief of the British Journal of Clinical Practice. On his way to the annual society meeting, he stopped in New York City to meet with a well-known physician who asked Sir Mengut where he was going. Sir Mengut replied, "Ogden, Utah, to address a surgical meeting." The New York doctor asked, "Why that hick town?" "That's quite a meeting they have out there," Sir Mengut said. "Cattell, Auctioner, and Bacchus have all spoken there, and if it's good enough for them, it ought to be acceptable for me." The Eastern physician wondered aloud why he hadn't been invited to speak, to which Sir Mengut replied, "Maybe you haven't arrived yet." Since the society began, there have been speakers from 29 states and 49 medical colleges and universities, as well as doctors from Canada, England, Brazil, Scotland, Sweden, Ireland, and Russia. In 1988, famed thoracic surgeon Dr. Lauren Hiratska received an invitation to present 3 papers for the Ogden Surgical Society. When he told his father, who was also a doctor, his father, who was Japanese American, got very excited. It turned out that during World War II, the elder Dr. Tomiharu Hiratsuka was studying at Stanford Medical School. After Pearl Harbor, he was arrested and sent to an internment camp. Stanford's Dean of Medicine got the elder Dr. Hiratsuka an internship at the D Hospital in Ogden, Utah. The doctor was able to avoid the internment and move there to do his internship. He remembered Dr. Dumke, Dr. Pfister, and Dr. Rich, and recalled how wonderful the doctors were, and that they didn't treat him differently than other doctors. Dr. Hiratsuka was able to bring his parents, grandparents, and siblings with him to Ogden. He continued to work at the D until the end of the war. He never forgot the doctors that treated him with such kindness. It came full circle for his son to attend the surgical conference founded by the very same 3 doctors who helped save his father's medical career. The history of the society is also a history of philanthropy in Ogden, as many of the contributions to the financial well-being of the organization involved some of the area's most prominent families. The support is motivated by the feeling that physician education leads to better patient care. Although doctors tremendously enjoy the conference and gain knowledge, the true beneficiaries are the members of the communities they serve. In the early years, conference topics tended to lean more heavily towards surgery, but by 1975, the topics became much more broad and included many non-surgical presentations. In 1979, Dr. Chelton Feeney, an internal medicine specialist, became the first non-surgeon to become president of the society. Therefore, in order to decrease the confusion and to make it clear that the society included all physicians, the name was changed to the Ogden Surgical-Medical Society in 1988. Some years, the general sessions had unifying themes, such as breast disease. Speakers would discuss various modes of diagnosis and management, including surgical, medical, and radiological. It is because of the foresight of the 3 doctors and ongoing generosity of local families, the families of the 3 founding doctors, and the medical community at large that the Ogden Medical Surgical Society continues to provide quality postgraduate education to doctors, nurses, and many healthcare workers requiring ongoing CME certifications. In 1953, famed cardiovascular surgeon Dr. Edgar Van Noyes Allen, whose name is lent to the eponymous Allen test, and who is remembered for work done as a professor of medicine at the Mayo Clinic in Rochester, Minnesota, remarked, "I consider the Ogden Surgical Society to be a very great credit to the city of Ogden, and I consider it to be fortunate that the people of Ogden have available to them such a high quality of medical care. Many physicians told me that the meeting was the best which they attended each and every year." Today, The society continues to hold meetings annually and has a database of over 2,000 clinicians that have attended the annual conference in the last 6 years. Over the last 10 years, the highest number of conference attendees was 641. While the conference still consists of lectures and panels, hands-on skill lab performance sessions were introduced in 2009 to appeal to younger clinicians. While the Ogden Surgical-Medical Society is accredited for medical doctors, other health professional societies accept Ogden Surgical-Medical Society accreditation. These include nurse practitioners, physician assistants, podiatrists, and paramedics.